Special tests, sometimes called provocative or structural tests, are performed after history, observation, and examination of movements. The purpose of performing special tests is to find out whether a particular type of disease, condition, or injury is present. When results of special tests are positive, they strongly indicate or suggest presence of a particular type of disease, condition, or injury. Negative results, however, do not confirm that there is no disease or injury. In some cases, lab tests are needed to help confirm a diagnosis. In this video, I'm going to talk about a list of some special tests and their indication. Indication as in what specific conditions any of these special tests can help you to diagnose as a PT. Special tests for cervical problems. The first one is called foramen compression test. This test is meant for cervical spondylosis and conditions that can cause nerve root compression and result in pain which radiates into the arms. The second one is called distraction test. This test can help PT to ascertain and be sure that patient condition is really nerve root compression. So it confirms the aforementioned special test, that is foramen compression test. The third one is called shoulder abduction test, also known as Burkitt's sign, for symptoms of pain usually from C4 to C6 nerve roots compression from herniated disc and spondylosis, etc. Special test for shoulder problems. The first one is called apprehension test or crank test. This special test is for anterior shoulder dislocation. The second one is called relocation test. This special test also proves a positive apprehension test, that is, if there is indeed anterior shoulder dislocation. The third one is called sulcus sign for inferior shoulder instability. The fourth one is called speed test or straight arm test. This special test is meant for bicipital tendinitis. The fifth one is called empty cam test. This special test can also be used for supraspinatus strain or tendinitis. The sixth one is called drop arm test or Codman's test. This special test is meant for rotator cuff strains or tendinitis. The seventh one is called Root test. This special test is meant for thoracic outlet syndromes, known as TOS. Special test for elbow problems. The first one is ligamentous instability test. This special test is meant for ligament laxity, sprains, tightness of ligaments, etc. The second one is called tennis elbow or Cousin's test. This special test is meant for lateral epicondylitis or common wrist extensors tendinitis. The third one is called golfer's elbow. This special test is meant for medial epicondylitis. The fourth one is called elbow flexion test. This special test is meant for ulnar nerve neuropathy or cubital tunnel syndrome. Special test for hand problems. The first one is called Finkelstein's test. This special test is meant for De Quervain's tenosynovitis or Hoffman's disease. The second one is Tinel sign for carpal tunnel syndrome. The third one is Phelan's test or wrist flexion test for carpal tunnel syndrome. The fourth one is called Froment's sign for adductor pollicis muscle weakness. Now, other special tests for thoracolumbar problems. The first one is called SLAM test for impingement of sciatic nerve. The second one is called straight leg raise test for lumbar radiculopathy. Wow, so we've done a lot. We've studied about the special test that a PT can use in making diagnosis. Now, what you have to note is that there are numerous of special tests out there that PT can use. So demonstration is very, very important. So on this note, I would like you to meet me in my next video as I demonstrate some of these special tests to you, so that as PT you can know how to go by when you have a patient or you come across a patient with any of the conditions that each of the special tests can be used in making diagnosis. Thank you very much for your time. Have a nice day. Bye.